Ryan, my name's Nicole. I'm going to be your nurse today.
Hi.
Can you please tell me how you've been doing since the last time you came?
Not bad. I've been better. I've been worse.
Okay. I have some questions that I wanted to ask you.
Okay.
They're personal in nature about your relationships. Is it okay if I ask them?
Sure.
Okay. First question I'm going to ask you is, in general, how do you describe your relationship? A lot of tension, some tension, no tension?
A lot of tension.
Okay. Do you and your partner work out arguments with great difficulty, some difficulty, or no difficulty?
Great difficulty.
Do arguments ever result in you feeling down or bad about yourself? Often, sometimes, never.
Sometimes.
Do arguments ever result in hitting, kicking, or punching? Often, sometimes, or never.
Sometimes.
Do you ever feel frightened by what your partner says or does? Often, sometimes, or never.
Sometimes.
Has your partner ever abused you physically? Often, sometimes, or never.
Sometimes.
Has your partner ever abused you emotionally?
Often.
Thank you so much for sharing that with me, Jesse.
Yeah.
Do you mind if I ask you some more questions about your answers?
Sure.
Okay. So when I ask you these questions, you said that your partner has abused you physically. Can you tell me a little bit more about that?
She will hit me, kick me, scratch me. It's nothing that where I'm afraid for my life or anything, but it is something that it's not fun. It's not fun to endure.
No one deserves to be hit or feel bad about themselves, and I think it's important for you to know that no one deserves to feel that way or feel that they are undervalued.
Thank you.
You also answered that sometimes you feel bad about yourself after your arguments. Do you have anyone that you can talk to about your feelings?
Not really. I've lost touch with my friends over the years, especially after I got back from Iraq.
Mm-hmm.
You kind of lose touch of people and you change. And my wife doesn't really like me to hang out with my military friends because she says we drink too much. And now that it's been 6 months since I've had a drink, and that's kind of what we do when we get together. So I'm trying to be better about that. But again, my wife doesn't really like me hanging out with them at all. So.
Mm-hmm. So what I hear you saying is that not hanging out with your military friends helps you not drink. And I think that's probably good for your health and for you and also for your probation. Do you think that there are other forms of support that you can seek out, either through a church or through any kind of outpatient treatment that you're doing, like AA?
So I don't really
Are there
know.
people that you could talk to?
I don't really know, where to go. To be honest with you,
Okay.
if I'm sure there are places to go. I'm just not familiar with them.
Mm-hmm.
It'd be something that if I had the resources, I would be willing to.
Mm-hmm.
So.
Okay. Well, I have this card here, and it gives you some resources that either you or a friend might need in case you need to talk to someone, or you feel like things at home are getting out of hand and you just need some help. So it's a small card, you can fit it in your wallet, and if you don't need it, you might know someone else who needs it, and it's something that I give to most of my patients.
Okay, great. Thank you.
You're welcome.
I would definitely look at that.
Well, it's been really nice talking to you, Jesse. Do you have any other concerns you'd like to share with me, or anything else I can help you with?
No, I'm gonna take a look at these other resources and just go from there. I mean, I'll see you guys next week, so maybe we can touch base in and see what's been going on.
And I'm sure you know this since you've been coming to see us, but I just want to reiterate that whatever you say in here is confidential as long as it doesn't involve any children being hurt. And I really appreciate you coming and being open on this
Great.
with me.
Thank you.
Have a great day.